Hello friends, today we'll be discussing a very important and a useful topic. Today we'll be discussing what are the exercise related issues in valvular heart disease patient, because this is a very unusual topic. Most of the patients and most of the doctors are also unclear whether patients having significant valvular heart disease problem should be allowed to exercise or not, whether that will benefit the patient or whether that will harm the patient. Because if at all the patient is having a significant valvular problem and the patient does exercise, that will increase the pressure gradients across the valve. So in some way that might even harm the valves. So whether the patient should be allowed to exercise, what is the benefit, what is the risk, what are the persons who should be allowed to exercise, what are the problems associated with exercise, this is what we will be going to discuss in this video. This is extremely important for all those patients who are suffering from valvular heart related problems. First of all, should the cardiac patient having a valvular heart problem be allowed to exercise? If at all the patient is having a mild problem or a moderate problem, the patient should be allowed to exercise. Valvular heart problems can be subcategorized into mild, moderate, severe, which means very less amount of problem, slightly more amount of problem, or maximum amount of problem, which is the severe category. If at all the patient is having a severe problem, then depending on the problem, the patient might be given a specific advice. But mild to moderate problem, they should be allowed to exercise, because that will improve the stamina of the patient, that will improve the functional capacity of the patient, that will decrease the amount of dyspnea of the patient, and that will also enable us to understand whether the patient is having a dyspnea related to valvular problem or related to low amount of stamina. Because sometimes the patient with the valvular problems comes to us with only dyspnea. We do not know whether the patient is having a dyspnea because of the valvular problem or a dyspnea related to a low functional capacity or low exercise tolerance of the patient. Sometimes we even do a treadmill and the patient walks only for 5 to 7 minutes. We do not know whether the patient should be sent for a surgery or should not be sent for a surgery, because echocardiography doesn't look like a very severe problem, but the patient is very dyspneic. So that is why if the patients are exercising on a regular basis, that physical deconditioning part and the stamina portion will be completely out, and we can actually assess whether the patient is having significant amount of effort intolerance which is related to the valve. So this will help in decision making also, and this will improve the stamina and functional capacity of the patient, which can delay the surgery also. Because even if the patient is having a significant valvular problem or a severe valvular problem and the stamina is good, we can avoid the surgery for a few months, and the surgical risk of the patient also would be lower, because studies have shown that the patients having a very low functional capacity, the surgical risk is higher. Patients having a high functional capacity, the surgical risk is lower. Next, if at all the patient is having heart failure, then of course the patient should be advised to exercise, because exercise increases the effort tolerance, improves the stamina, improves the functional capacity, and it will improve the valvular problem as well. One big issue is that if at all the patient is having a valve narrow or a stenotic lesion or a valve regurgitation, that means a leaky lesion. So both of these cases, if at all the patient is forced to exercise too much, then what will happen, that the pressures across the valve will be much higher and the valve will be subjected to much more gradient. So the patient's valve condition might deteriorate at a much more rapid pace. So what I recommend to these patients is that they should exercise, but not very vigorously. Routine patients, whenever we advise them to exercise, routine cardiac patients, we usually advise them that they should exercise to 85% of the target heart rate achievement. That means target heart rate means 220 minus age of the patient. That means if the age is 40, 220 minus 40 is 180 beats per minute. So the patient usually is advised that he should achieve at least 85% of the target heart rate, which means for a 40 years old person it will be 180 beats per minute, and they should exercise to a functional capacity of more than that, so that they build up their stamina. But in valvular problem, especially the severe valvular problems, we will advise the patient that they should exercise maybe at a lower level. They can exercise maybe at 50 to 60% of target heart rate. So in a 40 years old patient with a significant valvular problem, we will advise that they should exercise with a target to keep their heart rate between 110 to 120 beats per minute, and not to 150 to 180 beats per minute, which will increase the valvular problems and which might cause sudden deterioration of the patient. This is especially applicable for the patient having valvular stenosis, because the rate will not affect that much of a valvular regurgitation problem. But sometimes what happens, that the patient will have a combined valvular problems, especially with the patients having rheumatic heart disease. The patient will have a stenosis plus regurgitation. That means the valve is narrow and structurally damaged, which is causing a leakage. So these patients, it will be much better suited if the heart rate is not very high. Then, of course, if the patient is having atrial fibrillation also, then too the patient will be advised to not to exercise too much, because atrial fibrillation will increase the heart rate and the heart rate will become very high and the patient might go into sudden failure. So the patient should be first put on beta blockers, that is rate reducing medicine, antiarrhythmics like amiodarone, which will control the rate, and maybe rhythm normalization might also be achieved, and diuretics like urine increasing medicine will be given to this patient, which will decrease the fluid pressure and the pressure gradients across the valve. Then the patient can be allowed to exercise. But in patients having significant valvular problems, they should be much more cautious as compared to the routine patients. What if the patients have an acute heart failure? Of course, of the patients having acute heart failure, excessive exercise should be avoided in these patients, especially if the valve problem is in a severe category. These patients should be performing exercise at a much more restricted pace. What should be done if the patient is having a clot in the ventricle? If at all the patient is having a valvular problem with a clot in the atria of the ventricle, then the patient should be advised to exercise not at a very vigorous pace. They can still walk and jog at a slower pace, but very vigorous running should be avoided in these patients, and the patient should be avoiding all high risk position of yogasanas and all, in which the head is tilted above, like Shirshasana or Bridge Asana or all sort of Naukasana and all sorts of asanas where the patient is expected to put the head level below the body level. That means the anti-gravity sort of a position should be avoided in these patients, because these patients can have sudden embolization of the clot to the brain or to the periphery, which might deteriorate the condition of the patient. So any patient having a clot in the chambers of the ventricle or the atria because of valvular heart problem should be advised to avoid vigorous exercise, especially the dangerous forms of asana where anti-gravity position is the patient takes an anti-gravity position. What about those patients who have undergone a surgery? If at all the patient has already undergone a surgery, then the patient can feel free to exercise. But of course, if the atrial fibrillation and clot and other valvular problems are there, then the same amount of restrictions will be applicable to the patient. The patient has to keep the heart rate and the pressures across the valve at a restricted level, at a normal level. Patients having a metallic valve usually are much more free, because metallic valves are usually less likely to be damaged because of exercise. Exercise related high gradients will not be able to damage the metal of the valve, although some pannus formation in the valve might be increased. Patients having tissue valves should be advised to not exercise very vigorously, because studies have shown that the more active the patient is, especially young patients who are implanted with a tissue valve, the valve deterioration occurs at a much faster rate as compared to elderly patients or people who are not very active. So because the valve gradients are not very much in these patients and the valve is not very much used, so the structural deterioration in elderly patients who are less active is lesser as compared to young patients. Although we do not strictly advise the patient to be on complete bed rest once he is put on a tissue valve, but comparatively over vigorous exercises should be avoided when the patient is put on a tissue valve. Whether the exercises does actually damage the valve or it doesn't damage the valve is not proved in very big trials, but this is a hypothesis which a lot of people do agree with, that very vigorous exercises should be avoided in all these patients. After surgery, once the condition is improved, then the patient should feel free to ask. In chronic heart failure patients with valvular problems, if the valve problem is not very severe, they should definitely exercise because that will improve their stamina. What if the patient develops palpitation during exercise? The exercise should be stopped and the patient should take rest once the palpitation reduces, because the palpitation can increase the gradient across the valve, which the heart failure patient or severe valvular problem patient may not be able to tolerate. So the patient should be advised to do not very vigorous exercise if at all he is having a palpitation and the heart rate is very high. Suppose the patient develops chest pain if at all he is having a valvular problem, then too he should stop, especially when the patient is having severe aortic stenosis, because aortic stenosis patients are much more likely to have sudden cardiac arrest if at all the patient is having a severe valvular problem and the patient exercises very vigorously. So severe aortic stenosis patient should be advised to not to exercise very vigorously, because it can be dangerous for this patient. One more important thing is, if at all the patient is of valvular heart problem is exercising in a winter season, they should take much more precautions as compared to a regular patient. They should get themselves vaccinated from pneumococcal influenza and COVID vaccinations, and they should not exercise very vigorously and not go out in extreme cold environment, because they are much more likely to catch infection, and once they catch infection, then they can suddenly deteriorate. So they should protect themselves from the cold if at all they are exercising in winter season. Extra precaution should be taken. Next is, once you are going out for an exercise, you should keep an emergency health card in your pocket, because sometimes this patient might suddenly drop down unconscious and the people surrounding the patient will not know what exactly has happened with the patient. So they should keep a card where their name, their phone number, their blood group, their emergency contact number and the doctor's number or the disease which the patient is suffering from should all be mentioned inside the card. That should be kept in the purse or the pocket of the patient, so that if at all the patient is having any spell of unconsciousness or some event has occurred or some stroke has occurred while the patient is exercising, then these people can be informed and the patient can be rushed to the hospital immediately and the relatives can be informed. So an emergency health card is a compulsion in all sorts of cardiac patient, especially a patient with a valvular heart related problem. Next important tip is, if at all the patient is having any injury and the patient is having an anticoagulation regimen, the patient should be extra careful that he does not receive any injury or cuts if at all he is exercising, because the chances of having a very dangerous form of bleeding and uncontrollable bleeding is much higher in these patients. So the patient should avoid injury, especially to the head, because if at all any injury occurs to the head, then there might be uncontrollable bleeding in the brain and the patient might die also because of that. So this will create complication, and the patient should avoid any injury or bleeding if at all he is having a valvular problem and is on a blood thinning medication. If at all the patient does develop stroke, then he should definitely exercise, because exercise will improve the muscular capacity and improve the strength of the muscle. So the patient should exercise, especially if it is guided with a physiotherapist. The physiotherapist should advise to the patient what type of exercise the patient with a stroke should do, so that the physical capability and the muscle capability of that particular muscle will improve. So the patient can be advised accordingly by a physiotherapist if the valvular heart disease patient develops a stroke or a paralysis attack. Last is, what is the relation of exercise in interpretation of the timing to surgery? If at all the patient is exercising regularly and is physically active, if the stamina of the patient is deteriorating rapidly and is not improving with medicine, the patient is taking regular medicine but the stamina is not improving, then we can consider that the patient will require surgery. If the effort tolerance is decreasing, then it is a clear-cut indication that the patient with a severe valvular problem, and if there are no other confounding variables like anemia, like coronary artery disease or like other problems, then the patient can be considered for an early surgery if the stamina is deteriorating significantly, not maybe 10% or 20%. If it is deteriorating by 40-50% stamina, then the patient can be advised a surgery if at all it is significantly documented, especially if it is documented on a treadmill test. In this topic, we have discussed about the specific issues pertaining to exercise in a valvular heart disease patient. If at all you have any comments, queries, suggestion or any topics pertaining to which you want us to discuss in our subsequent videos, you can write to us about them in the comment section below. We will be happy to answer your queries and discuss about the topics in future. The people who are new to my channel, I would request you to subscribe to my channel, as this gives us a lot of inspiration and motivation to continue the good work in future. The people who do not want all the technical details, they can stick to the YouTube shorts which are regularly uploading on our channel, and we have a lot of playlists on our channel. If at all you have any particular query or particular disease, you can go to the specific playlist on my YouTube channel, and on that playlist you will be able to find a lot of relevant articles and videos and shorts which you can directly refer to without wasting too much of time, and you will find much more relevant data pertaining to the disease which you want to listen about.